And welcome back to the studio. And we hope that all of those out there who are over 39, American, of course.
Nobody's over 39.
39 American.
Okay.
The dollar is going down. So if you have a pen and paper, jot this number down because this is the best free advice you're going to get. This is a very expensive guest we have here.
Yes.
And so the number is 1-855-958-8255, or you can tweet us at What She Said 167, because we all want to know how to look younger. And not all of us want to have a surgical procedure. So Dr. Peter Bray, a cosmetic plastic surgeon, is here with us today, and he has going to discuss all the latest treatments and some great new technologies, Dr. Bray, including Fractora.
Yeah, that's a great new one. May I just add that perhaps expensive, but worth every penny.
Worth every penny. Absolutely worth every penny.
It's an investment in yourself.
It is an investment.
And your self-esteem and feeling good and loving yourself. And, I think whatever makes you feel good is worth it.
And it does make people feel good. They want to look as good as they feel. And more people are interested in non-surgical technologies these days. And fortunately, there's now a lot of really good ones. Fractora is one of my new favorites.
What is Fractora?
It's a method for tightening skin, improving texture, reducing fine wrinkles, and it uses radio frequency energy that's actually delivered right into the skin where you need it. And afterwards, it's like having had a bit of a sunburn, but very easy recovery process. And it's now a great alternative to a lot of the laser or light-based treatments, has a number of advantages that way.
Like when you have something like this done, how long does it last? Like how long before you need a touch-up or a redo?
With Fractora, it starts with several sessions, and those sessions a couple of weeks apart, perhaps 4 weeks apart, and the number of those sessions will depend just how much of an effect someone wants to see, or, well, really how bad their skin is. And then after that, maintenance maybe once a year or so. Again, that'll also depend on their lifestyle. People who have lots of sun damage and, perhaps haven't taken the best care of their skin may need a bit more of an aggressive touch-up routine. But it is an investment. I think that's the best way to look at it. And unfortunately, the clock does keep on ticking, so paying a bit of attention.
No, it doesn't. Everybody's 39 or under.
Well, that's
39 American.
The ages don't change. No. That part I've come to learn, for sure.
Yes.
So what are some of the best age-defying and preventive measures we can take to look more revitalized and refreshed without surgery? What are the best ones?
Well, a lot of these probably your mother could tell you, and makes good sense. Good sun protection is really important. It does prematurely age the skin. Preventing or stopping smoking. Smoking also ages the skin prematurely. And then having a good skincare routine, medical grade skincare can make really nice differences.
What's medicals?
Well, it has higher levels of active ingredients, and this is different from the
active ingredients, meaning
Retin A is a good one. That one's got lots of scientific proof behind it, and these are things you can't typically get at the drugstore. They do have to be under the advisement of a medical spa or medical doctor, dermatologist.
So would they be prescription?
No, these are not prescription, but they have those.
They're
higher
not
level.
at the drugstore,
That's
so you
correct.
can, or they're not at the Bay or whatever. You'd have to you have to go to a registered spa to get them, or through a cosmetic surgeon.
Ideally, having a proper assessment by someone with medical or expertise in managing skincare. And for that reason, you get the higher potency ingredients and arguably better results with that.
So what would the cost difference be? You mentioned something like Obagi or SkinCeutical.
Yeah.
What is the cost of that?
The costs actually are not necessarily all that different from some of the things you see at the drugstore, which are incredibly expensive in some ways. But you can be expecting to spend several $100s a few times a year, sometimes more than that. So it's more than just getting a jar of moisturizer at the drugstore, but then again, you get the benefits of better products with active ingredients. And those always tie in nicely with the more aggressive treatments we would do, getting into the laser, light-based treatments. And pretty much anyone who is a candidate for Botox or injectable fillers can also benefit from a good medical skincare regimen also.
Are there some types of skin that are either react better or tend to age more quickly? Like is a very fair skin different than a darker skin? Like does that make a difference?
Oh, sure. And the best advice here I could give is to choose your parents carefully.
Well,
the genetics absolutely play a role. Certain ethnic backgrounds too.
Absolutely. I mean, I have friends who are black, and their skin is gorgeous.
Absolutely. Yep.
It doesn't seem to wrinkle, or it just they look way younger.
Yeah, and this gets back to the need for a proper skincare assessment, because there's definitely no one-size-fits-all product. Having a customized and strategic approach is going to give you the best results for sure.
Wow. So you're going to say something?
No, I was going to talk about fillers.
Yes.
What do we know? So Fractora would do the surface.
Yep.
In the meantime, you want to moisturize and cleanse your skin properly with things that have really strong, potent ingredients.
Yeah.
Not necessarily prescription, but that a cosmetic
But they're
surgeon,
targeted.
But they're yeah. And so if you do that and you keep that as a regimen, you stay out of the sun, you use sun protection, and you don't smoke, or you quit smoking, or whatever you do, then if you don't want to have surgery, because this is really what we're talking about, is trying to look good without maybe having an invasive procedure. So Botox for a few wrinkles, but fillers are big. And I'm hearing that men are starting to do an awful lot of this stuff.
Fillers are very popular, and they're really effective, provided they're done tastefully, because we don't want anyone walking around looking like chipmunks or the duck lips. But men, for sure, I'm treating a lot of men with fillers these days. They've realized that these are quick, effective, and safe ways to make a change, and they can be back to work, back at the gym, and done with restraint. No one really notices. It doesn't jump out as though they've had something done. So I look at this as almost like remodeling a room in your house, where you want the structure to be good, the 2x4s and the baseboards and stuff, but then the drywall and the wallpaper has to be there too. Fillers are kind of like the 2x4s, building structure, enhancing shape, replacing volume, and then things like Fractora and medical skincare are the drywall and the wallpaper that finish the job.
Well, Nick, you mentioned that something you said there just to me says it all, though, where you want that where people look at you and say, "Wow, you're looking so good,
refreshed."
But you don't
rested.
want the key, I guess, being you don't want someone going up and, "Wow, what did you do to your face?" Like you want to look like you 2.0.
Yes. I think too much exposure in the media these days, where fillers have been done excessively or done wrong, and just watch an episode of The Housewives of wherever, and you'll see a lot of that. But restraint is the key, and perhaps doing multiple sessions over a period of time.
Gradual.
Yes, and that way there's less of a transition there, and people at work or friends, family are less likely to say, "Oh my gosh, what did you have done?"
But do you find that in the society, the way things are right now, we are a society of excess in many, many ways, and where people come in and just give me the biggest, the best, the most right now?
For sure. It's a big is better, more is better kind of culture, and the media definitely promotes that. But most people, that's not the look or the impression they want to give. They want to look better, feel better, but still have a natural appearance where it doesn't change them into sort of a caricature of themselves.
So, Dr. Bray, can you stay with us and carry you over the break? Because we have some more questions to ask, because I think that's really a tough thing for a doctor when you've got a patient saying, "I want more," and you're saying, No. or maybe you're not.
A step at a time.
A step at a time. Let's do it. Anyway, we will be right back with much more with Dr. Peter Bray after this break on What She Said, Canada Talks 167, Sirius XM.
And it is What She Said. I'm Sharon Caddy with Christine Bentley and our friend and guest, Dr. Peter Bray, cosmetic plastic surgeon. And Dr. Bray, we want to get into some of these different things that we can treat non-surgically. My question before we actually get into specifics, though, is, I mean, we are hearing more and more often of younger people coming and getting procedures done. Is there a point, like, if you're looking at yourself in the mirror day to day and you start to see things going, is it better to get a kind of a jump start on things, get started sooner? Or is it harder as a doctor if someone comes in that's, coming in much, much later down the line, like where there's more, I guess, space to be made up?
Coming in later and later down the line when there's been a lot of age-related changes, then we have to be realistic about what we can really achieve with non-surgical things. And the truth is that facelifts, neck lifts, the actual surgical procedures are still by far the most powerful way of dealing with the advanced changes. Now, for people who want less magnitude of an appearance change, then the non-surgical things can still be excellent. But it really comes down to having that discussion with the patient, seeing what their expectations are, and then making sure that the solution is able to deliver it. What I don't want to do is offer a non-surgical treatment to someone who really has surgical expectations, because that's just not fair.
Do you find that there are people who are afraid of surgery?
Absolutely.
And also, and that's one reason. And secondly, that they can't take the time off work to heal. So they want to come in and have something that maybe their skin's red for a couple of days. They can handle that, but not 3 weeks or however long it would take.
Absolutely. There's a huge spectrum of tolerance for surgical things. Some people have absolutely no problem investing the time and the energy and the money to do that. And then other people wouldn't do it, even if it was the best thing in the world. So the good news is there's lots of options in between now, either non-invasive treatments or what I'd call minimally invasive ones, which are surgery, but much less risk, much less downtime than traditional surgical treatments.
So what treatment can offer the biggest improvement in the shortest period of time for an overall refreshed look? And we're talking non-surgical.
Hard to beat Botox and injectable fillers for that. They're safe, effective, and offer a really nice and can be a natural improvement too. Beyond that, there's all sorts of additional things in the minimally invasive category. As far as non-surgical ones, a lot of these we do at the Bel Air Laser Clinic, my other office. Methods for skin tightening, improving skin texture, a series of laser and light-based technologies, really tending to the patient's needs.
Okay. Well, we've got kind of a list of things if we're, you know what? Because everybody's got their thing. If you're standing in front of the mirror in the morning and you're going, okay, I'm seeing those laugh lines, those folds, what's the best course of action?
Laugh lines, great treatment, and the most popular one being injectable fillers.
Yeah.
And that may mean adding a bit to the cheeks to give some volume and lifting, and then going after the laugh lines directly. And depending on how the skin quality is, often involves some treatment for that as well, whether it's Fractora, Fraxel laser, sometimes Thermage. Again, an individual assessment really is important.
When it comes to the injectables, though, I mean, I've heard, I haven't done any of them, but I've heard of different types, different brands, different whatever they are. Does certain doctor work with certain brands, or is the gamut available to anyone based on your skin type or the depth of lines? I mean, how do you choose, or how do you know what the patient would do best with?
There's a range of different products for sure. I, as a practitioner, could choose any one of them. I have my reasons for the ones I use, and I stick to the ones made of hyaluronic acid, which is extremely safe. It's virtually impossible to have an allergy to it.
That's important. Never even thought of allergy.
No.
Yeah, well, back in the days of collagen, that was a problem. So I think the hyaluronic acid products are terrific. There are other ones that are safe and effective. Important to have a discussion with the practitioner why they may choose that or not choose another, and make sure you're fully informed.
So, Dr. Bray, one of the things that I've heard a lot about from people that they don't like about themselves at a certain age is their neck. Mm-hmm. I guess turkey neck, but even if it's not turkey neck, just the jowls sagging and just the skin drooping. And is there anything besides surgery that can be done about that?
There is now, and in the past it has been an area.
Okay,
this sounds like a big thing. This is a big revolution in your industry.
Yes, it is. Botox can help a little bit with that, but it's a very stubborn area when there happens to be a lot of loose skin that sags. So the treatment I'm doing most often is a type of surgery, but minimally invasive. It's got a great name. It's called neck tight. And this is using energy under the skin surface where it can be much more powerful and getting better tightening of the skin, but also I'm able to reduce the little puddle of fat that accumulates there and sculpt the jawline at the same time.
So what you say it's minimally invasive? What do you do?
What do you
actually?
do? Yeah.
Where do you go in and what do you do?
A tiny incision under the chin, and it's invisible by the time that all heals. Using local anesthetic to make the area numb and completely comfortable. Using a small instrument that emits the energy and also allows me to gently suction away that little pocket of fat at the same time.
And what happens to the loose skin?
The energy heats it from underneath, and that heating encourages tightening. So by keeping the energy levels, very precise, get a bit of the best of both worlds.
So what would the cost of that be, the range?
Around.
That's a few $1,000s.
A few as in two?
I'd say 3, but it'll depend on the magnitude or the amount to be done. That said, it ends up being very good value because there's no other non-surgical treatment that can really make as big an impact in that area. Whether it's lasers or light-based treatments or surface treatments, there's only so much they can do.
And what is the recovery time for that?
It's a week or so of some swelling and bruising, but minimal discomfort.
So if you did it in the winter and had a turtleneck, you'd be okay?
Perfect.
Yeah, there you go.
Could
It's
go
all
to work.
timing.
No, I mean, because certain things, if you have certain skin layers or whatever, you can't go out in the sun for periods of time. So that would be something that... And do men find that popular?
Yeah, men think it's great. It's one of the areas that bugs men a lot, definitely ages them, so they ask for options and alternatives that don't require them to take a huge amount of time off, and also that isn't going to be too noticeable. They don't want to hang around, lock themselves indoors, and stay out of the public for a long period of time for sure.
I've seen, for a lot of people that have in the past undergone whether it's just an eye lift or whether it's a full facelift or whatever you've had done, so your face is looking really great, and it's just this, and then you end up wearing all these scarves and stuff all year long because the neck is the dead giveaway.
Exactly. I was just going to say that. The neck is the giveaway.
It is.
And you can tell. You're looking at the face going... The face and the neck don't match.
But now
now
you can fix it.
Now you can have neck tight.
There's options now. It's terrific.
And that's not overly expensive.
No, it's not really.
And for a week, of swelling and bruising, but not... is the bruising confined to the neck?
Yeah.
No, it doesn't go up to your face?
No, not unless we're doing a face treatment at the same time. Often we are treating the face and the neck together, and it just makes sense to do that because it compresses the recovery process into one tidy little event.
So let me ask you, with the pressure on people to look younger, to look more refreshed, and people really do, even men. 20 years ago, you didn't hear about it. Maybe it happened, but you didn't hear about a guy. You didn't even hear about guys getting manicures, and now they do. So is there more and more product and more procedures coming on the market? Are they flooding the market now with the demand, or is it pretty standard new technologies?
There's new things on a weekly basis.
Wow.
Yeah. So part of my job is to keep on top of those things, to research and get a sense of what's effective and what isn't. Now, a lot of those are what I'd call evolutionary products, but not revolutionary. And I certainly don't think it makes sense to jump on the bandwagon of every new technology that comes around. What I think really is the most exciting is combinations, you making use of the best of different types of technology, because there is no single magic bullet. There's no single technology that's going to solve everyone's problems. But by combining things to achieve a nice result and a patient's expectations, that's the most powerful method, in my opinion.
Once you come in and get, so say someone comes to you, has a consultation, you say in between you decide that, a little bit of filler and maybe something procedure gets done, and you got your patient looking great. I would imagine, though, that your relationship, doctor-patient relationship, which should be an ongoing one where you check in once in a while. How often really should a patient consider coming back in to get looked at?
Most people, they're having some Botox every 4 months, and that's a pretty good timeline. If they're coming back in 3, maybe 4 times a year for their Botox, it's a great time to reassess and see how things are going. Maybe fillers twice a year, and then occasionally more frequently if they're in the process of a skin rejuvenation session. So there's kind of a natural cadence. The guideline I like to use is roughly once a season. A visit is
That's
great
not
just
bad.
to see how things are going.
Because it's not prohibitive. I mean,
No.
You know what? If it meant entering into some kind of a thing where I have to be coming in at least once a month, then I've got to do this and I've got to do that. I mean, we're busy, right? But I think everybody can make, if you want to take care of your appearance in that way, you can make time 3 or 4 times a year.
Yeah, and you can look at it like getting your hair done. No one has a question about coming in every month to get that taken care of, and this is the same type of thing where it requires some ongoing maintenance.
Yeah, and also people's lives may change. So you may have had a huge life event. Maybe you've been ill, or maybe you've had changes, especially for women, weight, hormonal changes that maybe change the texture of your skin or whatever. And so 4 months seems like a good,
I think it's fair.
Yeah, good.
I think that works really well.
And so last question, how do you deal with people who ask you for things that you really don't feel are good for them or appropriate for them, and you just don't feel that they're going to look good, but they're insisting on having it, and you know that person is a billboard for you when they walk out?
Well, that's definitely part of it. I have to feel good about the treatment I'm offering and comfortable that it's going to satisfy their needs. So if I can't deliver that, and certainly if I can't really see the problem that they're talking about, I have to politely decline or offer some alternative. The last thing I want to do is engage in a treatment that I don't feel good about, I don't feel is going to satisfy their needs, because then I'm unhappy, they're unhappy, and nobody wins.
That's really admirable, because I think a lot of people have the impression that they can go in, it's like the candy store. You just say, I'll take that and that and that, and it's really nice to know that a professional is going to say no. Occasionally going to say no.
And to be realistic as well with expectations and about recovery, because those things, a lot of people go in expecting I can have this done and I'm going to look fabulous tomorrow and feel perfect tomorrow. And there are some realistic expectations to get through a procedure properly.
Yeah, absolutely. Occasionally I'll have someone comes in, it'll be 2 days before their niece's wedding, and they want to look great, and I have to say, well, we should have seen you about 6 weeks ago.
There you go.
Yeah. Exactly.
Yeah, so planning ahead is key, but always a pleasure to have you here, Dr. Bray.
Oh, I'm so glad to be back. Thank you.
Dr. Peter Bray, cosmetic plastic surgeon, giving us advice on how to keep looking our best.
Yes.
Thanks so much.
Which is 39, by the way.
39, and I'm holding to that.
I love those 39 birthdays.